Welcome back. Hundreds of UW nurses are moving closer to a strike next month. Wednesday this week, they voted to authorize the strike unless UW opened negotiations with them. And on Thursday, UW made clear in a statement that would not happen so long as legal complications remained. Act 10 muddied the waters, and UW has maintained throughout this 3-year process that it is not legal for them to recognize the nurses union. That is despite a non-binding opinion from the Attorney General. I'm joined now by one of the leaders in this effort, Shari Signer. Shari, you're in the middle of a work shift over there. How's it going?
It's good. It's busy, but it's good.
It's been 2 days now since this vote. Have you heard anything from UW leadership directly?
Yes. Dr. Alan Kaplan did send out an email to all the staff, letting us know how disappointed he is in the fact that SEIU is moving towards a strike. Again, he keeps referring to SEIU as a third party, not actually recognizing the fact that these are his nurses who are moving forward with a strike. He talked a lot about how disruptive it will be to patient care and that it's up to the nurses to back down and to end this, because it isn't going to get us where we want to be, and it isn't going to end in them recognizing us. So that was the email, the gist of the email that he sent out.
That's also fairly similar to the statement released to media on Thursday regarding that. I want to read you a piece of that statement and get your reaction to that. So from UW Health, quote, "The decision by SEIU to conduct a strike is disappointing. They will harm patients knowing that their actions will not gain them an answer to these legal questions. They will also harm patients knowing there is a better option." What's your reaction to that?
We are 100% not harming patients. We actually have done more than we need to by releasing our strike dates earlier than our 10-day notice. It is up to UW to replace every single nurse at this hospital so that patients aren't harmed. This is not SEIU's doing. These are the nurses. The nurses are standing up for the patients and for ourselves, because we are tired of having profits go before patients.
Governor Tony Evers actually tweeted his support for you just a couple hours ago. We're taping this on Friday morning. He's urging UW Health to come to the table. What's your reaction to that?
We thank Governor Evers for his support, his continued support, and we hope that the hospital takes his direction.
It seems that we're at a bit of an impasse here following the UW statement, following this vote to strike. Are there any other steps that could potentially happen to prevent this strike from happening in about 3 weeks here?
I mean, this is all up to hospital administration. They have yet to tell the community or the employees why it would be so bad to have SEIU back in the hospital. This hospital ran extremely successfully for years and years with SEIU's support. They constantly say they legally can't recognize this, but yet they don't say why. I mean, they twist it so that they say that it's a gray area and we don't have clear recognition, but who is going to stop it? And what are their reasons as to why they think that this would be a bad thing for the hospital to re-recognize us?
I know you're in the middle of about a 12-hour work shift right now. You've clearly probably been interacting with patients, and clearly this news is probably making quite a few, waves among the patient community at UW Hospital. Are you hearing anything from them?
We are. Almost every single patient that I have spoken with today has mentioned it. Some are concerned about the time frames and if it would delay any of their care, to which I have said that as long as the hospital does what they're supposed to do and covers the staff, that their care should not be delayed. Every single patient has been in support, and they say that they stand with us, and they've asked how they can get involved to try to help the hospital to recognize the nurses and to do what we've asked of them.
Now, you've mentioned to me before this strike is 3 days, but it's open-ended, meaning it could go longer than that. How does that impact scheduling?
Never being part of a strike, I can't really respond to that. This is my first time being involved in anything like this, so.
Definitely new territory for everyone, many people involved. Thank you so much for taking a few minutes out of your day and joining us today.
Thank you very much.
All right. Coming up next, drunk driving crashes in Dane County are spiking in the first half of